Before we start our discussion on high blood pressure, which is also called hypertension, I would want us to try this practical example. Place your right hand just below your nipple. What do you feel? As for me, I feel my heartbeat. I know for sure that you are feeling your heartbeat. The heart is one organ in the human body that works tirelessly without stopping. In the morning it's working, in the afternoon it's working, in the evening it's working. Even when you have slept, the heart is still working in order to make the body function. This means that the heart is very, very crucial and important for the body function. But sometimes, due to certain instances, there is higher demand on the heart to pump blood to all parts of the body, leading to high blood pressure or hypertension. So in this video, I would want to go into detail so that we talk about the causes of hypertension or high blood pressure. Now, we will divide the causes into two. We have modifiable risk factors and non-modifiable risk factors. So the modifiable risk factors are those which are associated with your lifestyle, the way you live your life. And the non-modifiable risk factors are not associated with your lifestyle. So before we go to the lifestyle, let us first consider the non-modifiable risk factors. So the first non-modifiable risk factor is age. As you know, when you increase in age or when you become older, you are at a greater risk of having hypertension or high blood pressure. The second non-modifiable risk factor is family history. If you have relatives who have been diagnosed with hypertension before, it puts you at a higher risk of getting hypertension. However, when you take good care of yourself by preventing the modifiable risk factors, you will not get hypertension. Now, let's move straight to the modifiable risk factors, or those which are associated with your lifestyle. The first one is high intake of salt. If you are one kind of person who takes in higher amount of salt every day, it puts you at a greater risk of getting hypertension. There are also some kind of people who don't know that taking in a lot of processed foods also puts you at a higher risk of getting hypertension, because these processed foods contain a lot of salt. They use salt to preserve the food in order to prevent it from spoiling. I hope you understand. So eating a lot of processed food comes with a high amount of salt. So indirectly, you might not be eating a lot of salt, but if you are one kind of person who takes in a lot of processed food, you are taking a lot of salt, because they use salt to preserve the food in order to prevent it from spoiling. Now, another modifiable risk factor that you need to prevent is smoking. Any cigarette or tobacco you take in has something we call nicotine. Nicotine has an ability to make the blood vessels which blood is flowing through constrict or become narrow. And when blood vessels become narrow, it makes it difficult for the heart to pump enough blood to all parts of the body. So smoking is one of the risk factors or the causes of hypertension. So I would entreat you that you need to prevent smoking or quit smoking in order to prevent you getting hypertension. The second one, or the next one, is alcohol intake. If you are one kind of person who takes in a lot of alcohol, it puts you at a higher risk of getting hypertension. Also, lack of exercise. You need to begin doing exercise, because exercise makes every part of the body function very well. So you need to start doing a lot of exercise, because lack of exercise puts you at a higher risk of getting hypertension. Also, overweight or being obese. If you are one kind of person who does not regulate your weight gain, it puts you at a higher risk of getting hypertension. So henceforth, you need to consider the weight you gain. If people tell you that, oh, you are becoming big, and you say, oh, thank you, you need to take note that increase in weight too much puts you at a higher risk of getting hypertension. The last one I will talk about in this modifiable risk factor is high intake of fatty food. If you are one kind of person who takes in a lot of oily food or fatty food, it puts you at a higher risk of getting hypertension.